The first cases of measles this year now reported in Wisconsin as part of the worst outbreak nationwide in more than 30 years. Wisconsin health officials say 9 cases now confirmed in Oconto County. The people exposed, officials say, during out-of-state travel. For students preparing to head back to school, Wisconsin has one of the worst vaccination rates in the country, about 86% statewide, according to the state health department, and that number is falling. Dr. Jonathan Temte is a professor at the University of Wisconsin School of Medicine and Public Health and the former chairman of the CDC's Vaccine Advisory Committee. He joins us now. Doctor, good to see you. Welcome to the show.
Well, thank you so much, Matt, for having me. This is a pleasure to be here.
You were part of the group back in 2000 that declared measles had been eliminated in the U.S. I'm curious now, 25 years later, your thoughts as we sit here today.
Well, going back 25 years ago, I came into this meeting with very little knowledge of measles, with very little knowledge of vaccines, but a lot of knowledge on primary care practice. But I was totally blown away by how good the global epidemiology was, how we could track cases and based on their genetic signature, know where they came from. I was equally blown away by the incredible effect of a vaccine in shutting this down. And I was also just amazed by the dedication of people that were behind trying to get rid of measles. So in 2000, we declared measles eliminated in the United States, and that has been preserved for now a quarter of a century.
Was that a mistake to make that declaration?
Nope, it has been eliminated, which means we don't have continuous chains of transmission throughout a year. And so we have maintained that. We recertified this back in 2012, but in 2012 we made the point that one of the biggest threats was the declining use of vaccine. And I'm afraid that this year we may very well lose that elimination status, meaning that we now have measles circulating throughout our population.
Given history and given what you know, what should we expect here in Wisconsin in the coming days and weeks? Should we expect more cases?
If I was going to make a bet, I would say that there's a good likelihood because there's such a large amount of cases across the United States. The likelihood that Wisconsin sees additional cases is fairly high. And the likelihood that we keep on seeing cases across the country, unfortunately, is very high, too.
At what point would you become alarmed here in Wisconsin, whether it be number of cases or locations?
I think anytime we have cases be identified in communities with low vaccination, then you really have to turn on the public health system.
City of Milwaukee, for example.
For example, and when there's one case, then you turn on surveillance. So you're looking very, very carefully. You have to amp up public communication. But doing that case finding, is there going to be a second case? And you don't know for 2 or 3 weeks.
We've seen this declining vaccination rate for years here in the state, across the country. From your research, from all of your time involved in this, do you blame people for losing faith in science or government or vaccines?
I don't blame people for loss of faith, but there is a lot of misinformation, and it's increasingly difficult for anyone to have up-to-date, credible information. And that's why I always tell people to have conversations with your healthcare provider, your doctor, your nurse practitioner, your physician assistant, somebody you trust who is up to date with that information.
Dr. Jonathan Temte, the former chairman of the CDC Vaccine Advisory Committee, UW professor. Doctor, thank you so much for your time.
And thank you so much, too.
Coming up, the potential bid for governor one-on-one with Congressman Tom Tiffany at the fair and his recent phone call with President Trump.